One of the latest things we're very proud of, this new treatment for multiple myeloma. It's called CAR-T. You can get it in the United States. It costs a huge amount of money, but here our doctor managed to legally create a much less expensive version of this, and something that is probably possible for not only our country. She's already treating multiple myeloma, and it will now be available throughout the world in an affordable place for places that don't have the kind of budget that we have. A very promising treatment for macular degeneration is based on stem cells. Israel has an advantage that we're one of the few OECD countries that had stem cells available, so that we now have treatment for macular degeneration using stem cells. Likewise, stem cells are being used in a breakthrough treatment in back surgery, where many people have broken limbs, other parts of the spine, and they're unable to have real surgery because they're frail from other reasons. They're either old or very sick. And we now have something called awake surgery, where the surgery can be done very quickly. That's the direction that we're working in the high-tech area.
The hospital has an open door policy, treating every single person who comes through its doors without regard to religion, race, nationality. Every single person has health care here. And the same is true in terms of the staff working here, coming from every background. So everybody is working here together and everybody is treated here together. And in fact, for this reason, in 2005, Hadassah Hospitals were nominated for the Nobel Peace Prize. And this is really one of the core elements and core aspects of our values and of the ethos of the hospital. It is also a true center of excellence. We have over 200 research projects happening here at any given time. We serve more than 1 million people annually, and we're really at the forefront of innovation worldwide.
I'm very hopeful about the African continent. Why? Because there's more and more awareness thanks to the internet. So the younger generation is becoming more and more aware, and that things can be done, things can change. So on the structural processes, first of all, we need to build hospitals like this. We need to have the infrastructure. Not only build the infrastructure, we need to equip the infrastructure, we need to train people, and also we need to create linkages. When it comes to training, we have a lot of medical schools on the continent, but now the problem is we don't encourage a culture of research, which is really key, which is really a centerpiece here at Hadassah. Because the more you research, the more you innovate, the more you know, and then the more possibilities you have, you can help people. We need to increase in terms of offer, the kinds of procedures we do back home, and this can only come true if we train more people, which goes into the structural part of we need to train more people, we need to buy equipment, we need to improve on supply chain management.